feel is going to be the better part of the discussion, and that is the panel discussion with some of the experts from around the state who have actually pulled this off in the early phases. So you're looking at the people who have pushed this locally and got a victory. And I'm going to introduce each of the members first and let them share a little bit about their story. So the first person I'm going to introduce you to is Ryan McGuire. So Ryan is from Alachua County. He's worked on tobacco prevention issues in Alachua since October of 2018. He's received both his Bachelor's of Arts in History and a Master of Public Health from the University of Florida. He currently leads the Tobacco-Free Florida grantee efforts in Alachua County, while also assisting with data analysis and communications for the COVID-19 response. I challenge anybody on this call to say that they're not dual purposing with COVID at this point. Outside of work, Ryan enjoys hiking, weightlifting, cooking, and traveling when there isn't a global pandemic. My favorite line of any bio that was sent in. I enjoy traveling when there's not a global pandemic. And so I'm going to turn it over to Ryan to share a little bit about his experience in Alachua County.
Thanks, Dr. Hummel. I won't speak terribly long, but thank you again to you and Valerie and WhipDoc for inviting me to participate. Obviously, I think this is a very good opportunity for other counties to get together, talk about their successes, their failures, and how we can continue to advance these TRLs locally. So Alachua is obviously propped up a little bit because we did achieve this first. I sometimes say it's a little bit of it was left a little bit lightning in a bottle. Very strong partnership members who are really just passionate about this. We had strong community leaders who wanted this, but we will say that since that retail license has gone into effect, it has been received relatively well, not just locally, but statewide, gotten Alachua some great attention. It wasn't the easiest thing to accomplish. We've had some unexpected challenges and things that did come up, but in my 2+ years of working at our health department, it's been a very fulfilling, rewarding practice. Obviously works with Brittany every step of the way for a lot of assistance and figuring out some new challenges. And there's a lot of things that went into it that we didn't anticipate in 2018 when it passed, and then in 2019 when it went into effect. Lots of new things with communication, outreach, education, a lot of challenges, but it's definitely been a good experience. So looking forward to sharing more of that. Thank you.
Awesome, Ryan. Yeah, we're really excited to hear from you. I have questions I've written down for you, believe it or not, about some of the enforcement information. So great to have you on the call. Next up, we have one of the stars in QuickDoc. This is Kim Wasser-Nash, who is our tobacco prevention specialist and community health advocate in Martin County. She's been with us since 2012. That makes me feel old. Working in community outreach and policy change and coalition building. She is a 2012 Florida State University Alumni Association 30 under 30 recipient. So I don't want to do any math there, but 30 under 30 in 2012. Anyway, she's also the 2015 AFP Treasure Coast Volunteer of the Year, the 2013 and 2014 Rising Leader Award recipient for the Florida Public Relations Association of the Treasure Coast, and she's a graduate of Martin County's leadership class number 23. It is a delight for me to welcome Kim.
Hi, thank you guys so much. My picture is also probably about from 2012, so no longer under 30, and the picture maybe not as updated as it should be, but I'm here from Martin County, as you've probably already heard, is that we had the great accomplishment of being the second TRL policy to pass in the state, and that was at the Martin County Commission back in, I guess, November. We'll talk a little bit more about that, but we definitely faced a lot of challenges. The first reading, there was a lot of unexpected resistance to doing this policy, but we pushed through it largely in fact, and thanks to the fact that we had a champion who was on the county commission, and Commissioner Stacey Hetherington, who's now the commission chair. She has 2 kids in middle school, so this was a big issue for her, especially considering middle schools here are where a lot of the vaping selling and use is starting, unfortunately, on campuses pre-pandemic when kids were still going to school. And we also then moved into a smaller policy with the city of Stuart, which had a different set of challenges from the county. So look forward to talking a little bit more about that.
Thanks, Kim. I was delighted to be part of that process in Martin County and attend a couple of those meetings. And it's always touch and go in those meetings, but it's always a lot of fun to actually see something cross the finish line. So kudos to you for a very good effort in Martin County. Next up, we have Kylie Savoy from Indian River County. She is been with us just since 2018. She's our community health advocate and tobacco prevention specialist there in Indian River. She graduated from UCF in 2018 with her BA in sociology, but with a focus on the social determinants of tobacco use to guide tobacco prevention efforts. She's currently working towards her master's in public health with a focus on epidemiology, exploring how tobacco use is associated with food insecurity. She's been a member of our team for almost 2 years and continues to work toward her goal of achieving health equity and tobacco control. I'll tell you that Kylie came to us when she had an intern project. She ran past us, can I work with you guys on an intern project? And Leslie Spurlock, who was in Indian River at the time, supervised that project. And then Leslie, at the young age of 66, decided she wanted to retire. And whenever I get those phone calls, it's always dicey. It's like, here's this fabulous person who's worked for us for a long time telling me she's going to retire. But everybody who's ever left us has always said, but I have found the perfect replacement. And so Kylie was recommended. And Kylie, if she stays with us till she's 66, well, first of all, I won't be here. But anyway, if she stays with the organization till she's 66, that means we've done a good job shepherding this organization into the future. So without further ado, let me turn it over to Kylie.
Yeah, and thank you, Dr. Hummel, for that introduction. So I have been with the Quit Talk Foundation for 2 years, and I've been working on tobacco retail licensing since 2019 in August. Right when Leslie decided she was going to retire, we had one last meeting with the county commissioners to just introduce them to something we were going to be working on in the future. And our champion at the time was like, oh no, let's do it now. They had ended up voting it down and waiting on state action, but since then we have worked with the city of Vero Beach to raise the age to 21. And as of yesterday, the county is looking at raising the age to 21 and licensing retailers. They did approve that yesterday, so it'll be interesting to see the language that comes out of that. But I am excited to kind of share my experience with everyone, so thank you.
Yeah, thank you, Kylie. Again, once you get the ball rolling, let's say in Indian River County or Vero Beach, if the city does it, then the county feels compelled to do it, and so that's the second county where we've had that happen, and so that's been fantastic. And then, of course, last on our panel, I won't spend a lot of time reintroducing her, Brittany Chapman, who's the representative from Tobacco Free Florida, who works on this policy at the state level. And so I'm going to stop sharing my screen, and we're going to move into sort of a panel discussion. I encourage everybody, if you haven't already, to put this into speaker view so that whoever's speaking at the time will be the main face you will see on the screen. I'm actually going to start with Kylie. I have a question here that I think your story fits the most, and that is, what have you found to be the biggest barriers in obtaining buy-in from decision makers on policy change, whether that's Tobacco 21 or the TRL, and how have you kind of fought back on those barriers?
So I think one of the most common barriers that I have encountered with my work with the city and the county is they don't want to over-regulate business. That is a phrase that I hear time and time again is, oh, we don't want to over-regulate. And it really comes down to reminding them that, one, nicotine is a drug. It is a drug that is as addictive as heroin, cocaine, and alcohol. And, Dr. Hummel spoke to how we regulate alcohol in this state in particular. There are a lot of different counties that have a lot of stricter regulation. And so it's important that, we do remember that nicotine is a drug. And then also just reminding them we're not over-regulating at this point. The federal law is 21. The federal law does ban the sale of flavored cartridges. So really you are just aligning our county with the federal law that is already in effect. And usually once you remind them of that, they understand, oh, okay, so this isn't an over-regulation. This is just so we can enforce what is already in place.
Kim, I feel like you have a little bit of a similar, maybe not as hard as Kylie's story's been, with something like you were talking about at the first meeting where you had some resistance that popped up late. Is there anything, do you have any insight on that? How do you cross those barriers when they pop up?
Yeah, long history, Dr. Hummel and I, he's been really active here in Martin County. So we have a lot of long-standing relationships with many of the commissioners in Martin County who have been commissioners for many years. So going into the first meeting, we obviously knew where some of them stood, especially the one who was championing this whole policy. But some that we expected who have really been progressive and advocating for tobacco control measures in the past kind of threw us for some surprise. And the main reason that they stated was because they were concerned about, like Kylie said, overregulation, but primarily putting a burden upon businesses who already have a state license in requiring them to get a local license. And originally, Martin County was planning on a $300 license fee to, right? It was $300, is that right there?
Yeah.
$300 license fee. And that was going to not only cover the cost of all of the enforcement and the checks on the stores, but it was also intended to form a fund with the county that they could then use to fund tobacco prevention measures through the schools and things like that, and education programs, which would have been amazing. But because there was some concern about the requiring a second license, almost immediately that $300 fee was removed from the conversation. It also wasn't tied to the ordinance. They were going to vote on what the fee would be after they passed the ordinance, so it was really not relevant to the conversation. But regardless, they ended up negotiating a compromise through their legal department, which basically, if you already had a state license, you weren't going to be required to pay for a second fee for your local license. Only if you didn't have a state license would you be required to pay a fee. And with that, it kind of took the argument off the table that you were over-regulating or putting a burden on these businesses. One of the other things that we got a few times that came up was your mom and pop like bookstores that also happen to sell cigars in the back. I'm just going to let you all know that I've lived here my whole life and we do not have any mom and pop bookstores that sell cigars in the back. So I don't know who those stores were, but I think the biggest point that we overcame that was when Commissioner Hetherington, who was spearheading all of this, in between the first reading and the second reading, she went out and met face to face with the cigar shops that were here in town. I think that was where most of the resistance was coming from, is what we found out. And the fact that she sat down with the owners of those cigar shops, asked them what their concerns were, and then addressed their concerns was the major reason that we ended up with a policy win in this. So I think not being available and not being afraid to approach your natural opposition on these issues is one of the most important takeaways, because they actually spoke in support of the ordinance at the commission meeting, which was not expected. To have a cigar advocate group representative stand up and say that he really didn't have a problem with the ordinance was the reason that it unanimously passed.
Yeah, and just because I was part of that one, I'll add that the big issue for the cigar owners was the issue of self-service. And because many of these higher end cigar shops have a humidor where people walk in and pick and choose, and they have boxes of products laying around the store, the compromise that was reached was the IDs checked at the door. So if you're in the store, the self-service becomes less of an issue. And that's how they couch that terminology to allow the cigar store owners to still have, so adult only stores. It wasn't specific to the necessarily to cigar shops, but it addressed the key issue for the cigar owners was that they do business differently than a convenience store. And they're not really, and we know they're the kinds of cigars most of those businesses sell aren't the kind that are targeting kids. The kids aren't going to go out and get a $30 cigar that's, you know, cognac, dipped in cognac. That's not what they're buying. So yeah, Commissioner Hetherington did an amazing job by actually going out and speaking to those. And it was probably, I think it was 3 or 4 cigar shops who were involved in that conversation. And to have them speak, yeah, I'm with you, Kim, to have them speak in behalf of it on that final reading went a long way to why it was a unanimous vote. Of that, I have no doubt. So I didn't know if Ryan or Brittany wanted to jump in on the question of barriers early in the game. Does anybody else, any insight they want to add? All right, well, the next question I have here is more about coalition building. What's the best way to gain community partnerships, members, school districts, leaders, et cetera, who give support and assistance when working on a policy change like this? And I think I'm going to start with Ryan on this one, because I think Alachua County had good success with this. Ryan, did you want to touch on coalition building as you're heading into this?
Yeah, absolutely. So I think I would take a couple of different approaches for this. I think in terms of advancing a specific item within your partnership, you really have to identify some strong champions, 2 or 3 people who can totally get behind it. I think a few people who are dedicated, going to put in the time, the effort, the work to further advance that is good for an individual policy. But when we are talking about your partnership or your coalition as a whole, you have to try and recruit a wide umbrella, a large group within your community. Something in Alachua County we had a lot of success with, honestly, was just networking with other community groups and seeing what their interests were and what they were pursuing. So for example, at the same time as the retail license was being advocated for by Tobacco Free Alachua, the local council PTAs was pursuing something called the Children's Trust, which was basically just funding for children's programs. So both of these groups targeting things that impact the community's children, schools, working towards the health physically and mentally of kids. They can work together and talk about and support for each other. Hey, we are doing the same thing in a slightly different way. So Tobacco Free Alachua and our partnership in general saw a lot of success, honestly, just going to meetings for other groups, supporting them however we can, even if it was just by showing up. But then in turn, they were incredibly supportive of tobacco-related efforts. And I think that just goes towards any other lasting change or relationship you would want within your community. We don't want these things to be transactional, like, hey, I'll sign your petition, you sign mine, I'll go to your meeting, you come to mine. But letting these groups know that, hey, we are both working for positive change locally. Let's be supportive. Let's hear each other out. Maybe I can connect you to someone at the health department or someone at the hospital network that might be helpful. So just really being there for a more of a lasting back and forth as opposed to like a handshake and you move on.
Has the Children's Trust become sort of a permanent part of your partnership as a result of that, or did they work to you specifically on the tobacco license at the time? And
so the people who currently oversee the Children's Trust aren't, but the groups that were advocating for it have. So the council, PTAs, a lot of local school moms, and some people within the school board have become more regular partnership attendees, yes.
Kim, I feel like I hate to go back to you again, but I feel like you had an interesting approach to that coalition building that might be a really cool strategy for some of the other locations. I'm thinking specifically when we started early in the process.
Yeah, well, and 2 things. One was all Commissioner Hetherington who championed this, but she brought together a coalition early on when in the very first stages of talking about this. We also have one of our partnership members, she's on the call, Jen Ahern, but she's with Children's Services Council. And she was also really instrumental in those early processes and meeting with commissioners, but bringing all of the stakeholders to the table. So between Children's Services Council, from the Sheriff's Department, the school district, county staff, everyone who is going to be involved in this and implementing this, they brought it all together. They had a meeting early on, talked about the reasons behind it, concerns that people had, got it all out on the table. And because of that, they had really strong support early on. One of the things too that really helped is at that first commission meeting when you had some pushback about how they would be able to implement all of this and how the stores would be affected. One of the deputies who just happened to be at the meeting, because he's at every meeting, just stood up and he was like, he knows what's going on because he's been involved in this from the very beginning. And he just mentioned that, they were really concerned about certain stores. They knew who the offenders were. They knew who they needed to pay extra attention to. And just having him aware of what was going on and the reasons behind it and on board, that shareholder buy-in is one of the reasons that it was so successful.
I think that's one of the reasons they were all in on enforcement also. They were brought to the table because I was at that very first meeting and everybody was sort of trying to figure out what they wanted, what would be the ideal thing, and everybody was there, making valuable suggestions. And they were in on the enforcement piece from the very beginning and stayed strong on that enforcement throughout the process. Yeah, I thought that meeting, the reason I wanted to talk about that is because I thought, you're right, the champion was key because she called that meeting. Like if you called a meeting or somebody else called a meeting, maybe not as, but this was the commissioner calling sort of a task force meeting is what I guess you would call it, with the school district and the health department and the sheriffs and Children's Services Council, and we were involved. And I thought that was an incredibly smart way to do that. And by the way, for people who are listening, when the state law wasn't signed, that's one of the reasons it was easy to pick this back up and run with it, because so much of this kind of community legwork had happened leading up to this, that it was easy to restart that process. It wasn't kind of a scattered kind of process. It was very well organized. But again, a single champion is probably one of the more effective things that you could ask for with a government agency like that. Did Kylie or Brittany, did you have anything you wanted to add to that sort of coalition building piece of it?
Sure, I do have just one quick note I would add. I think on a more preliminary level, when people are trying to think about, how do I identify some of these groups that would be most affected by the policy that we are educating on and hoping to ultimately have adopted. I think, just going real basic and looking at some of the data and where, some of the more pressing issues are manifesting and in which communities they're manifesting. Dr. Homo, you talked earlier about the way menthol products were designed to be used, and we know how flavor products are designed to be used, and just a lot of the predatory marketing that can really tailor the message that is being delivered in order to kind of make that pitch to build the coalition. And in doing so, from the start, it could be very helpful to make sure that not only you have the PTAs and the Boys and Girls Clubs and, some of the well-known community stakeholders, but so that you have individuals from those communities that would ultimately be affected by the policy, because they're ultimately being affected by the retail environment, making sure that you're diversifying the representativeness of those voices. And when, the issue is brought forth to the decision makers, that, that messaging is brought from the individuals that have the power to organize and make the change on down to the individuals that will ultimately be affected by the change. So that's the only little thing that I would add.
Yeah, it's interesting you said that, because the Stewart's experience, right? So they did the thing after Martin County, and they did the 21. They didn't really push the licensing issue. There was some issues with it. But in that conversation I had with one of the members of the city commission, one of the biggest offenders in the city of Stewart is by Stewart Middle School. It's in a minority neighborhood. And he said, we go and do these compliance checks, and then they accuse of us of picking on them because they're in the minority neighborhood. Boy, that's a tough, how do you fillet that fish? Because you are picking on them because they are violating it, and then they're using, they're trying to imply that you're picking on it because, and that's such a hard issue, because it really is affecting a disparate population negatively. And if you do the right thing, then maybe that comes across like you're being too heavy-handed with a specific subset of the population. So yeah, it was a really dynamic conversation I had with that particular commissioner as a result of that, because I could see it from both sides. I saw his side of the story, absolutely right. I can understand from a historical perspective where that store probably feels like they're being picked on. I see the whole big argument, but ultimately what I want to do is do what's right for the kids. And if there's a store in any community that's, selling to underage minors at a higher percentage than other stores, then I think that's what we ultimately have to, like, at the end of the day, we have to say, I'm trying to do what's best for the kids. I can't, I have to be a little bit careful about how I couch it, but I really have to do this because it's what's right for our youth. There was a question in the chat. I'm going to go off topic for a second because it kind of ties into this a little bit, but somebody asked if the state legislation was going to be reintroduced, and I apologize. This is so hot off the press. I meant to add it to my PowerPoint last night and I forgot to do it, but yes. So the bill that was vetoed in the fall was reintroduced by, there's a Senate version. The Senate number is 1080, and Matt Hudson is the senator who introduced it. And interesting, my understanding is Debbie Mayfield, who was actively involved in pushing this last year, is now the House Majority Leader, and she has been asked not to submit any legislation herself. But I have a pipeline of information that tells me that she has requested, she went to Matt Hudson and said, please introduce this. That tells you there's leadership support in the Senate side. The House side is the same language from last year, and I think it was Jackie Toledo, who is, I believe, on the west coast of Florida, somewhere, I want to say Pinellas County. I'm maybe off on it, maybe Hillsborough, but somewhere in that Tampa Bay area. And she has introduced her bill from last year, which ultimately was what was signed into law. So there are two companion bills that are probably going to get fast-tracked because of leadership's support of them. Now, two things I would say about that. One is I'm very hopeful that it will pass again because it did last year. I have no doubt. I don't know how the governor would respond to that for the second consecutive year. So what does that mean for us in the local community? Well, I think the reason it ties into this particular question we were talking about is, why don't we start building the coalitions now and have the discussion so that if something goes well, we don't have to worry about it, but if something doesn't go well, we're not starting from scratch again, and here is the fall, and now we're just starting to get it moving. Oh, and then they introduce it next year. We could play that game for a long, long time. So I think the time to soften up and build your support is now, because we'll know the answer by the end of April as to whether this passed or didn't pass. Then we won't know about the signing for who knows how long, but at least we'll have some sense of that. I probably wouldn't put the brakes on it this year, knowing that the governor vetoed it last year. And I would even kind of say that in your local community. I'm not sure if it passes and the governor's going to sign it anyway. So I think we should just keep, we can plug along on what we think would do, how we would best serve our community, I think would be the way to go on that. The next question I have is kind of tied in, and it's what is the easiest way to start the process without overwhelming decision makers? Because it is, kind of an interesting and a big ask. And I had, I had Martin on here mostly because of the thing we already talked about, Kim, which was the sort of, that sort of task force approach. I was wondering if anybody else had any other suggestions to just get your foot in the door, and because it's a big ask. Has anybody had any success with sort of getting the ball rolling early on? Or how do you identify a champion? How do you reach out and identify a champion? Any thoughts, Kylie, maybe?
Yeah, so I will go ahead and jump in. I know that when we came in August of 2019 to the commission and we're like, we're just letting you know this, and they kind of took it up and they're like, well, this is a state issue, we're not going to overstep. We were kind of back at square one, like, okay, where do we start? Where do we go? And we really identified our city government, and they had, 43 retailers. They were up there in retailer density. So we just went and had, the partnership had a conversation with them. And, we talked about the federal age being 21 and just the lack of enforcement. I think one of the biggest tools we had was just having that store mapper data for, like, of your 43 stores, 3 were visited last year. So, you don't have a picture of what's going on, and, overwhelming them with the license wasn't really where it was going to start. We weren't going to go in hot and heavy like, hey, here's a tobacco retail license, we think you should do this. It was more, this is kind of the concern that we're seeing in this area. How do you feel we can best address it? And so they chose not to go the license route, but to raise the age to 21 and do local enforcement. So the code enforcement officers are enforcing the 21 law. And what that allows the partnership to do is actually we have a great relationship with the person who is doing the enforcement. So we can follow it over the next year and say, hey, of the 43 stores this year, you visited 21. That's a great improvement from 3. But how else can we support this? What else can we do? And maybe from that point, they can say, oh, if we add some funding behind this, if we add a license behind this, then that's kind of where we go from there. But really starting with that enforcement and that lack of enforcement that's currently happening seems to resonate with them a lot without overwhelming them.
Yeah, I think the 21 is a good way to get your foot in the door, because there is a discrepancy. It's 21 at the federal level. That is the law of land. State law is 18. We have an enforcement gap. And you can get a conversation about raising the age locally and enforcing it better, which is sort of what Vero Beach ended up ultimately doing. And we had that similar experience when we had no age for vaping back in the 2012 era. And we were getting our foot in the door by saying, there's no age restriction on these products. You can pass that. Oh, and by the way, while you're doing it, you can roll them into, the Clean Indoor Air Act language, so people aren't using them in parks, playgrounds, beaches, or wherever. You can do it anywhere. And you can also put restrictions on point of sale, like we got product placement ordinances rolled into that. But we got in the door with the 18, and I think 21 is a great way to get your foot in the door, because it's a little bit of a complicated issue, but in a nutshell, like we talked about earlier, it's 21 at the federal level, but they're not showing up to enforce it. It's 18 at the state level, so they're not showing up to enforcement. How can we do better by our citizens in our local community? I think is the nuts and bolts in that. Did anybody else want to weigh in on that issue of starting the process without overwhelming folks?
I'll just add quickly that one of the advantages, so I think meeting with your local decision makers is really important all the time, not just when you have an issue. And fortunately, I knew Commissioner Hetherington through the leadership program prior to her running for office. And so we had conversations. I know her kids, I know where they go to school. So we had conversations about the issues that her own children were facing in their schools, being exposed to vaping and e-cigarettes and all that stuff. So when she was elected, we set up a meeting almost right away to talk about those issues. I think parents are in this particular issue and field one of the most important advocates for us because they know firsthand what their kids are dealing with. I've kind of almost seen it with our commission as their children are getting older. You can tell they used to really focus on issues that were a problem in tobacco prevention 5 years ago, 6 years ago when their kids were in school. And as those issues evolve, and their kids are older and not necessarily as affected, they maybe don't understand the changing demographics that we're dealing with and the changing issues that we're dealing with. So meeting with her firsthand and approaching it from what her kids were seeing, what stats we have from the Florida Youth Tobacco Survey, from the store surveys that we're doing that Kylie mentioned, and then talking about together why that's an issue and what the possible solutions are, got the ball rolling, and she really picked it up from there and made it happen.
You made a really interesting point without naming any names. Commissioners who we worked with 10 years ago that were incredibly supportive of issues changed their vote because now their kids are in college. I'm not saying they changed their vote because their kids are in college, but it was less of an issue for them because their kids were in college than it was for Commissioner Hetherington, who had kids who were right in the right age bracket for this to be a big time problem for her. Yeah, so that's a good point about trying to identify a champion. If you can find somebody who's got kids that are in the age bracket that are overly affected by, say, e-cigarettes, that might be a strategy you can employ too, is in trying to identify a champion. A good point, because I think the person who championed stuff in the past will not champion it anymore, as we learned in Martin County.
Mm-hmm.
Ryan, did you have anything to add to that before I move on to the next question? Anything about starting up the process?
No, I think she covered most of it. I would just also say as a general reminder that it's a marathon, it's not a sprint. And I think a lot of the success can be accomplished, like you mentioned, about not just communicating with your local leaders or community groups when you have an agenda item, but also just maintaining those relationships, continue to build rapport and inform them. And then when it comes to an actual policy issue, it almost turns into like Inception kind of, like you're just like planting the seed and, hey, this is like on the horizon. We just want to put this on your radar down the road. And as you start to do that to more and more people, you can sort of like test the water and see, oh, this person is incredibly receptive to this idea or this project. They have a personal connection to it, or maybe they know someone who does. So don't be afraid to just share things that are maybe 6 months or a couple of years down the road. It doesn't have to be in the immediate future, because then you can sort of get a sense of what the reception will be like in your community and who you can gravitate towards for support on that effort.
Yeah, and I think that allows you to get it the way you want it written. You know, like Martin County's ordinance was so incredibly strong because it was a long process. And does it have every single ideal thing in it? Probably not, but it's about as good of an ordinance as we hope to get ultimately at the time. Not you can't go back and fix it later, but the key was it was a long process where everybody got to weigh in on it, and it became a very good ordinance over time. And if you pass language in a hurry and you don't have everything in it, it's, it might be harder. And then it's the model for the next county or the next city. And you want to be careful about that. You want to make sure you have everything you want in there, because other people are going to look at that as models. Like people are looking at your ordinance, Ryan, as a model. Same thing with Kim's. I mean, that's the stuff that gets passed around a lot, is here's what Latchwood did, here's what Martin did. And they're good, solid ordinances, which is great. But if somebody passes, Vero Beach passes a 21 with code enforcement, people are looking at that language, they might go, oh, that's an easier way to do it. And if you really want a strong ordinance, you kind of want to, you want to make sure you get everything in it early on, because that's why in Broward, the approach is going to be, let's go to Sunrise and let's get a model ordinance done, because everybody else will look at that in the county. And if we go to 4 places and somebody does it quicker, but does a weaker ordinance, then that becomes the piece of paper that everybody passes around in the county. So I think it's okay to go slow. I agree with you, Ryan. It's okay to go slow and get it the way you want it, so that it's a model for other people to use regionally or locally. Think bigger picture about who might be looking at it down the road. I had a question come up that I'm going to address real quick, and that was, does the proposed T21 preempt stronger local laws? And the way the law is currently written, it's very similar to last year, and it does not. That was the language, the 1080, Senate Bill 1080 and the House bill that we talked about a few moments ago. Those are not preemptive of local ordinances at the moment, but you know how these things work. They go committee by committee, they get amended over time. They don't end the way they start. And so you do have to watch that. But as of now, it would not prohibit any of the things that we've been talking about today on licensing or on passing stronger or stricter rules locally. That language is not in there at the moment. This is a really good question that came from Columbia County, actually. When working toward a tobacco retail license in a city or a county, what components do you feel are most important to obtain? And some examples they put in here were the ban on flavored products versus reducing the number of retailers, a fee. I'm going to start off on that, and then I'll kind of pass the hat around. I think for me, the big ones are age, get the age in there, strong penalties for violations, and frequent, even if you define a number specifically, compliance checks. Those are the big three things for me. And the rest of it is, if you're going to underscore the ban on flavored cartridges or try to parallel FDA language on tobacco, which should be included anyway. I mean, it should be e-cigarettes. I mean, it should be redefining tobacco consistent with the federal level. But then after that, I think the thing is 21, make the penalty stiff for the retailer and hold their feet to the fire by going in there frequently to see them. Some of those other things, like we talked about in the presentation, are more plug-ins, like if you want to exceed the flavor ban or do retailer density and that sort of thing. So, but I'll pass the hat around and see if anybody else has any thoughts. Having a few of these in play, what the components were that I know, for example, Ryan, yours includes the retail density, for example, and there's probably a story as to why that was one of the things they focused on.
Yeah, Brittany, did you want to say something? I noticed you unmuted if you wanted to go first.
Oh, you can go first, Ryan. I'll follow.
Oh, no problem. Yeah, just to follow up on that, Dr. Hummel, something else that I think really got legs for Alachua County's license and a lot of people were able to get behind was the retailer restrictions, particularly when it comes to around schools. So one of the core components for Alachua is no new tobacco retailers within 1,000 feet of a public school. That's a very palpable message you can tell to the decision makers, like, hey, we have these kids walking out of school. They're looking for things to do. They're going to get snacks at a gas station. We don't want them to be more exposed to these products. Everyone has seen and read about the point of sale statistics that show how often kids are around these products. They're more likely to use them, try them, especially the advertising. In Alachua, any retailers that were within 1,000 feet of a school were grandfathered in. But that means if I own a vape shop right across from Gainesville High School and I decide to sell it, that next owner cannot maintain it as a tobacco retailer, which is pretty cool. But it's a very easy thing. Hey, we don't want these popping up around schools, but you could probably segue that into, well, what about public parks? What about these other spaces where young people are, depending on your community? And I'm sure you could do the same thing for beaches, other natural places, that it's easy to convey a message that's not too data heavy, but it really just makes simple sense.
Yes, Ryan, and this is exactly why I wanted you to go first before me, because I kind of had a feeling that would have been the angle you might have gone. So looking at it from, the bureau level, the statewide level, having a picture of everything, and also looking at some of the lessons learned from Alachua and from Martin County. What I would always recommend is, again, going back to the data. I know I'm going to sound like a broken record, but going back to the data to see really how bad the problem is locally first, because your decision makers are going to want to know why. And sometimes other than, the FDA did it, sometimes that's just not good enough for them. And they want to be able to know, why do we need to spend the time, the money, the resources, the energy, the effort to do this locally? So I would look at those factors. And then I would also do not root cause mapping, but I would do some power structure analysis and really do your homework on the decision makers and the communities that they serve. Because at the end of the day, they are hopefully wanting to be responsible to their constituents. These are the individuals that either voted them in or gave them a vote of confidence to become appointed or what have you. So you want to be able to basically highlight those issues relative to the communities that they serve in order to kind of make the argument as to why it would be necessary. It could end up that it's flavors. It could end up that it's zoning and density. It could end up that it's product placement. It could end up that it's age. You just don't know until you get in there and really start to decipher through that data and connect the dots based on what those decision makers' priorities are. You know, do they have children? How old are their how old are their children? You know, things like that.
I would just add, I echo everything you guys say, but for us, we reached a few challenges with some of those pieces that were really important to keep in there. I definitely think the great takeaway from Martin County, at least that they held on to, was that without having the retail license, there was no meat to this policy, because you can fine a retailer for violating the policy, but if you don't have the ability to take away their right to sell their products, there's really no consequence for them that matters, because they can pay their fines. I mean, they may make the sales up in an afternoon when kids get out of school. So they, when we went to the city of Stuart, that was the piece that they really couldn't click on. And I'm still, you know, fighting on that, because they did pass a policy. They didn't keep it in there. They did give strict fines, and they really felt assured that those fines would keep stores in compliance. I don't necessarily agree with that. So I'm still not letting that, you know, rest. But I think the other piece of it is actually following through and implementing the policy. So that was another thing at the county level. The sheriff's department was really on board with doing these checks. And their goal was to check every store twice a year. One of the pieces of data that Brittany provided me with was we have over 200 stores, and around 20 to 30 of them were being checked each year. So I mean, you may get checked once every 5 years. Not really a big deal from the ABT and FDA level. Having the sheriff's department on board with actually performing the checks was really pivotal. Unfortunately, the strongest language that they would put in the policy was regular frequent checks of the stores without an actual number that they were committing to. I don't feel bad about it terribly, because I know that there is long-standing support for actually going out and making sure those checks happen. I would like for it to be in writing, particularly as there's leadership changes and things like that. And if a new sheriff comes to office and isn't really as gung-ho about it, it may not happen. But I think the important thing is also just making sure that there's an implementation plan. So our county, I'm jumping to a question that I see in the chat box, but talking about if we have any data from this, our county just rolled it out this month. But one of the things that they did, I worked with them on getting a recent updated list of all of the retailers so that they could send letters to them to inform them of what was happening, so that they can immediately roll out. At the city level, they actually, before the ordinance even passed, started compliance checks. They're doing it through code enforcement, so it's a little bit different. And I think they were like having a lot of backdoor conversations about who they needed to check, and they just started doing it before the ordinance even passed its second reading. So making sure that it actually doesn't just pass as an ordinance, but is then implemented and introduced into regular process.
Yeah, and that addresses, I have a bunch of questions about enforcement, so you're dead on. And the key here is, if age restrictions alone worked, then there'd be no underage use. We've had 18 on the books forever. Use among 18-year-olds or under 18 should be 0, right? We know it doesn't work unless it's enforced. None of the policies we've put in place will work without some sort of checks and balances to hold people accountable. So you touched on one of the questions in the chat box. It's kind of parallel to one I have in advance of the talk, and that is, you know, what are the potential routes for enforcement? Because I think Martin County does it differently than Alachua County. So I'm going to let Ryan address how they enforce it in there. And then Ryan, while you're touching on that, I think I saw in the fall there was an article that you had some early enforcement data that was released back in, I think it was October or so, that showed that you had had turned up some stores that were breaking the law. So I'm going to turn it over to you about how you enforce it in Alachua.
Yeah, so to start on the first part about the enforcement mechanism, I think everyone in every county should work with their county commission, city, local leaders to see what they are most comfortable with. Because just because Alachua does it one way doesn't mean it works for Martin County or Indian River, Broward, or wherever it is. So I remember we went to our sheriff department a few years ago, and they were like, no go, like there's no way we'll be able to do this, which is fine. So you just have to find another route. So in Alachua, we do compliance checks through a private vendor called ISN. It's Information Services Network Corporation. And basically they are an existing company that already does FDA compliance checks, not just for tobacco, but for other items as well. So they already have logistics in place, systems in place. They don't have to reinvent the wheel. We presented this as an option to our county, and they were like, great, let's do it. Let's write a contract. And then the cost of the license pays for that vendor. And then what they do, it's written in with our local TRL at least once annually. Every single vendor will be visited with that minor who's about 19, 20 years old, try to buy the product. If they are busted, they'll try to get checked again. Obviously, last year was the first full year of us doing checks, and then the pandemic hitting, we had a little bit of a delay. We started January, February doing checks, and there was a huge gap. They didn't really continue until the fall. So we did not visit every single retailer last year like we wanted to, but they have continued and are progressing. And then as you alluded to, so I actually did get a little bit more recent data. And last year we saw about 110, 120 retailers total, which is about a third of those that exist in Alachua County. And of those, about 33% failed their compliance check. So we know even though there was a very long lead up to implementing this, all these retailers knew they had a ton of time, they were going to be checked. So we're talking 33% are failing. So not too great in the bid scheme. And that ranges from mom and pop places to Walmarts and Winn-Dixie's. So it's not just the little guys failing, it's the major retailers as well.
Yeah, it'll be interesting to see if a third got dinged the first time and now they know it's real. If that gets better, like again, the frequency of it's important, because if they get dinged once and then you never show back up again, you didn't really change behavior, did you? So that the frequency of it's really important, because if they know you're coming and you're coming and you're coming and you're coming and there's no end to it until they behave, you will change behavior. But if you show up once, and as Kim said, you know, you might get checked 5 years down the road, that fine or whatever penalty that they've paid has more than been paid off by, you know, just continuing to break the law in that gigantic gap. So yeah, I thought the reason I was interested is because there's been this big discussion about, you know, a third party vendor like the group you talked about versus law enforcement. And one of the issues with it is when, and I assume your reports you get back, Ryan, have like the denominator, meaning we tested, you gave the number. We went to 120 stores and a third failed, as opposed to a law enforcement only give you the tickets that they wrote. So in other words, if you went to 100 stores and they wrote 33 tickets, I'm going to get 33 tickets, but I don't know the denominator. I don't know if they went to 33 stores and it's 100% fail. I don't know if they went to 330 stores and that was a 10% fail. And I think the third party vendors reporting might be different and more important for us in public health, because I think knowing the percentage is really, really, really important. And I'm hopeful that in the law enforcement, like that we have a way to get the other information from a group like the sheriffs. Well, we did go to 120 places and we caught, you know, 15 of them, whatever. I think that other piece of information is as important as who failed, is who succeeded. And that be really important. Kylie, who does the enforcement up in Indian River or Vero Beach? Is that code enforcement or is that some other group?
It's code enforcement, but it's also a mix. The local police department does take on a good amount. So I believe a month or two after they had passed the ordinance, they went through it, the law enforcement went through and did 9 compliance checks. So they were already triple what they normally did. And so we had, I believe, 2 fail from that round, but they kind of help out code enforcement.
And does code enforcement use underage minors, you know, to go in and make attempted buys, or what when they do code enforcement, what are they enforcing, or how do they enforce it?
Yeah, it's usually they send in someone between, 18 and 20 who will go in and try and make a purchase.
Okay. Yeah, so they're not just walking by and seeing what's going on. They're actually doing the underage attempted purchase, because that's really important on the compliance of that. There was a question in chat that Val referred me to, and
I did just get a couple of directly. One was, how are retailers informed of any failures in compliance, and what procedure is the follow-up? And also, is there a standard form for compliance checks that everyone's using?
Ryan, I'll let you take that one first, since you have the
Yeah.
long history of compliance.
Yeah, absolutely. And then just as a little bit of an addendum to that, I think it's important to note that luckily for us, like our health department, our partnership, we aren't involved very deeply in the compliance. So it's like hands off from a grantee perspective, and our code enforcement and our county attorney handles the legal aspects. So how it works in Alachua County, it's a non-confrontational compliance visit. So the underage buyer and the ISN clerks, they go in, they try to make a purchase. If they do, they keep the product as evidence, they keep the receipt, they always take receipts when they are offered them, and then they give that information to county code enforcement, who then creates a letter that is sent to that retailer or whoever the owner is according to the license. Not always is that owner in Alachua County. We know like some of these Circle K's, Dollar Generals, they might live outside of the county but own a bunch of stores. So they are sent a letter saying, hey, we conducted our check on this day and time, you were found to have violated. You have to appear in front of a special magistrate on this day and time to hear your case. Obviously, every single buy, they have the evidence, they have the product and proof that the person was underage. So there's not really much to argue about it, but it still goes through a formal hearing process before they are penalized, which in the case of Alachua County is no sale of tobacco products for 7 days for your first violation. So it is a very non-confrontational. It's not like the sheriff or Gainesville Police goes in and serves them a subpoena or anything like that. It's just, hey, this was done randomly, unannounced, you failed, here's the procedure following through.
So
Ours is set up pretty similarly. I mean, it's just going into effect now, so I don't really have any data, but they both have to, in both the county and the city, if they're found in violation, they're going to have to appear in front of a magistrate. And they did roll the fee at the city level for the magistrate. That was one of the things they kind of adjusted their violation fee scale so that they were considering they're going to have to pay their magistrate fees, plus this is our fee. So this is what they're actually paying for violation.
Wow. Brittany, there's a question in the chat that's kind of interesting. Is there any data from other states that have adopted tobacco retail licenses? And I guess I'll parenthetically say, with decreased youth access, I guess would be the key thing we're going for here. Is there any, because so many states have started well before Florida.
Right. I'm sure there is some data out there because prior to us, 80% of cities and states combined did have some form of tobacco retail licensing. So what I can do is I can put out some feelers for what that data may look like, whether it's like point in time data or what have you, and provide that so we can have that information. But I'm sure there's data out there. I just don't have it readily available.
Yeah, it's been over, most of these, the T21 at least has been mostly over the last 4 years. I think it really started about 4 years ago when we really started to see it. And I'm sure in looking at the maps that I put up, there are some communities that went first that I'm sure have some data. And I'm sure a lot of other places jumped on board because there was data to demonstrate that it was working effectively. But again, if you don't enforce it, it doesn't matter what, you can make the age 100. If you don't go in and do a compliance check, you're not going to get any reduction in the use of anyone below that age. I had one other question on here that we kind of touched on it a little bit before, and that was going back to the menthol thing. I'll just throw it out there, and Brittany, you maybe, you've already spoke to this, but just in the context of this question, do you feel that prohibiting or restricting the sale of menthol and other flavored tobacco products will reduce health disparities and social inequities? And so I'll let you go first on that. I certainly have an opinion on that, but I know you probably have more data than I do.
I think it certainly can. And then there's also the issue of unintended consequences and things of that nature. So I think it's all in the way in which it's done. There was a point in time where, pharmacy policy was a consideration. And then the argument became that, you could be exacerbating social inequities based on the fact that, some people may only be able to get fresh food or healthy foods from pharmacies like a Walgreens or a CVS or what have you. So I think given the fact that those products are targeted and specifically tailored to disparate communities, whether it's low socioeconomic status, low median household income, low educational attainment, it is something that I'd like to see done at some point. I think it could be, it's all in the way that it's framed. I guess that's how I would sum it up. It's all in the way that it's framed. Because the argument can always be that, oh, well, once they're adults, they can do as they choose, but people negate the fact that 90% of adult smokers have begun prior to the age of 18. So I think it definitely requires a delicate approach in how the message is framed. It will definitely require a very comprehensive effort that cessation would have a big role in, because, we never want to be the villains here, right? We're already the cleanup crew, having to adopt policies or influence the adoption of policies that have resulted from terrible policies and processes for centuries now. But we don't want to give off the perception that, the unintended consequences are greater than the reward. So that's what I would say about that.
Yeah, I think if you look at the menthol ban, first of all, I think we should let the FDA handle the menthol ban. I think that's a complicated issue with a lot of social consequences to it that I'm not sure we need to be weighing into on the local level. But I will say that there's two groups of people affected by the menthol ban. There's the people who currently use menthol cigarettes, and if you just took it away, would have to confront the choice of something that's not menthol or quitting, right? I don't think, that group will have to make that decision if it disappears. People who use chocolate flavored cigarettes made that decision in September of 2009. It was the same thing. But the other group is the group who haven't started yet, right? We're talking about our underage kids who we know it's an easier point of entry. Just look at menthol. We know it's an easier point of entry to have a flavored product than an unflavored product. And so I'll go to the other flavors as a result of which is a broader topic, right? It doesn't come with the sort of baggage necessarily the menthol discussion has. There's all these flavored products, especially e-cigarette flavors. We know that some of the chemicals in there are causing problems. There was an article just last week about how the chocolate, things that have the chocolate flavor in it seem to be causing more lung damage than some of the other products. We've known that with the things that use the diacetyl, which is in the butter flavor. We know that they're more harmful, that some of the most harmful chemicals in there that you inhale are the flavors. And so again, you have two groups. You have the group that use the flavors currently, and you have the group that is being targeted by flavors. And I think we have to just make a decision. We should get rid of the flavors. I think it's the best approach to preventing youth use. And there will be a group of people who decided to use these, who have an addiction, will have to confront a choice. Do I use just tobacco flavor, even though it tastes like crap, or do I quit? Isn't that our goal? Reduce the appeal of it so that people who are currently using, that we did this with secondhand smoke. We improved the number of people who quit smoking because they didn't want to be inconvenienced stepping outside in the cold, or they didn't want to feel like they were some sort of pariah at the office anymore. And it made them look at what they were doing and make a decision to make a healthier choice. I know that might be tough love in some regards to say that we should just get rid of these flavors, and there will be a population that will be inadvertently affected negatively, but ultimately the goal is to make them make a better choice, be healthier in the long run, and just have to make that choice. Okay, you can't have chocolate, you can't have butterscotch anymore. You have to go with just what it tastes like, which is dirt. Sorry about that, but that's what it is, and that's what you're using now. And I think we ought to make that decision more broadly. And I think the FDA should take the lead on that. Of that, I have no doubt. So I'm not trying to push people in the local community from adding another thing that makes a complex argument when you're trying to get good policy now. But I think if you get language in there that says whatever the FDA decides, we should do too. If the FDA bans menthol, you can't sell menthol at your local convenience store anymore. And you can enforce that locally if it's written into your ordinance that way. And it helps get it out of there quicker that you do it locally. So that would be my take on flavors and menthol in general is, yeah, let the FDA handle it, but let's underscore those rules locally so that we can jump on it when it changes. We can jump on it quickly when it changes at the federal level and not have to go through this layer of trying to get the state to then weigh in with their slow process before we can do something more locally. So it's 12:10, which means we've exhausted the hour, and we still have more to talk about, but that's great. That was an incredibly dynamic conversation. I want to thank everybody for just doing an amazing job with some very complex issues. And I think we've demonstrated that there are multiple ways to do this, and that, working on the local community and being careful to what local needs are is probably the most important part. But there are some key things you can get in there that's consistent will go a long way to helping our kids.